This show is part of OnePlace, a daily network of focused briefings across the stories people follow most.
Welcome to our daily roundup. We are diving into a series of major breakthroughs in medicine, public health policy, and the environmental factors impacting families across the globe right now.
A young girl regains her sight through gene therapy.
A gut reset procedure helps maintain weight loss success.
Robert F. Kennedy Jr. shifts his stance on vaccines.
Common blood tests might predict Alzheimer's risk early.
New plastic film destroys viruses on physical contact.
Fatty acid supplements could reverse age-related vision loss.
Families struggle with health issues in temporary housing.
Early adult content habits predict future mental health.
Starting with vision restoration.
The story of 6-year-old Safi Sanford is truly remarkable. Safi was born with Leber's congenital amaurosis, or LCA, a rare genetic condition that prevents the eyes from producing a protein essential for vision. For Safi, this meant living in a world where low light was essentially total darkness. Her mother, Lisa, described the daily struggle of needing torches just to eat dinner or do coloring. Without intervention, Safi was expected to be completely blind by age 30. However, she became one of the first children to receive Luxturna therapy at Great Ormond Street Hospital. This one-off gene therapy involves injecting a healthy copy of the missing gene directly into the eye. The results have been described as nothing short of a miracle, with her mother saying it felt like a magic wand was waved over her daughter's life, restoring her ability to see in the dark almost instantly.
The emotional impact of this medical milestone became clear during a family outing last October. Safi was able to go trick-or-treating for the first time without fear, running down paths in the dark and shouting that she could see. Her parents were in tears, witnessing a future for their daughter that they once thought was impossible. This treatment is a significant win for the NHS and highlights the power of precision medicine. LCA is a devastating diagnosis for parents because it often comes as a total shock, as it did for Safi's parents who didn't even know they were carriers. By targeting the genetic root of the disease rather than just the symptoms, doctors have given Safi her peripheral sight and a chance at a normal life. She is now thriving, and her story offers immense hope to other families dealing with similar rare inherited retinal conditions that previously had no cure.
Next up,
as popular weight loss drugs like Ozempic and Wegovy become more common, a major hurdle has emerged. The weight often comes back once the medication stops. Research suggests that about 70% of people regain much of their lost weight within 18 months of discontinuing GLP-1 therapies. However, a new outpatient procedure called duodenal mucosal resurfacing might offer a solution. This minimally invasive technique involves using controlled heat to renew the lining of the upper small intestine. Essentially, it acts as a metabolic reset. In a recent clinical trial presented at Digestive Disease Week, patients who underwent this procedure regained significantly less weight than those who did not. This is a huge development because many patients eventually stop taking these drugs due to high costs, side effects, or a desire to avoid long-term medication. Having a one-time procedure to lock in the metabolic benefits could change the long-term outlook for millions of people.
the procedure targets the duodenum, which plays a critical role in how our bodies process nutrients and regulate metabolism. By resurfacing this area, doctors believe they can preserve the insulin sensitivity and weight regulation benefits that were initially triggered by the medication. Dr. Shelby Sullivan, the lead author of the study, emphasized that finding a way to maintain weight loss without ongoing drugs is a massive unmet need in healthcare. Currently, nearly 1 in 5 adults with obesity has tried a GLP-1 drug, so the scale of the potential impact is enormous. If this gut reset proves to be a safe and lasting intervention, it could move weight management away from a lifetime of injections toward a more sustainable, procedural approach. It represents a shift in how we think about metabolic health, focusing on the physical structures of the digestive system to maintain the body's new, healthier equilibrium after significant weight loss.
Now let's shift to...
In Washington, Health Secretary Robert F. Kennedy Jr. appears to be recalibrating his public stance on vaccines. Known for his historical skepticism, Kennedy recently surprised observers during 2 Senate hearings by adopting a more moderate tone. He noted that in his role he has funded the development of new vaccines and even urged children to receive the MMR shot, a vaccine he previously suggested was unsafe. This shift is significant given his leadership of the Make America Healthy Again movement, which has often been critical of the pharmaceutical industry and government health mandates. Kennedy even acknowledged that the MMR vaccine could have saved the life of a child who recently died of measles. This about-face suggests a strategic effort to balance the expectations of his core base with the practical and political realities of leading a major federal department responsible for the nation's public health and safety protocols.
While Kennedy is still pursuing a broad crackdown on alleged fraud and ultra-processed foods, his softer rhetoric on vaccines indicates a complex internal dynamic within the administration. Some leaders of the MAHA movement have expressed skepticism about this more moderate path, fearing that their core priorities might be sidelined for political expediency. Kennedy is essentially threading a needle, trying to maintain the support of an insurgent movement while managing the massive machinery of the U.S. healthcare system. His department is still looking at major cuts and a reworking of vaccine policy, but the public messaging has become notably more nuanced. This evolution is being watched closely by both the life sciences industry and public health advocates, as it will determine the direction of American health policy for years to come. Whether this is a permanent shift or a temporary tactical adjustment remains to be seen as he continues to navigate these high-stakes hearings.
Moving on to
a breakthrough in Alzheimer's research suggests that a routine blood test could identify risk years before symptoms appear. Scientists at NYU Langone Health have found that high levels of neutrophils, a type of white blood cell, are linked to a greater chance of developing dementia. This is measured through the neutrophil to lymphocyte ratio, or NLR, which is a standard part of a complete blood count. The study, which analyzed data from nearly 400,000 patients, found that these immune markers rise well before any cognitive decline is evident. This suggests that the immune system's first responders might not just be reacting to the disease, but could actually be contributing to its progression. By using a common lab value that is already part of regular checkups, doctors might soon have a powerful tool for early screening. This would allow for much earlier intervention and a better understanding of how inflammation drives the disease.
The scale of this study is particularly impressive, drawing from both NYU Langone hospitals and the Veterans Health Administration. Lead author Dr. Tianchi pointed out that this is the first large-scale investigation to show such a clear link between neutrophil metrics and human dementia risk. Because the NLR is so easy to calculate from existing tests, it represents a low-cost way to flag at-risk individuals. If neutrophils are indeed fueling the disease, this discovery opens up entirely new avenues for treatment that target the immune response rather than just the plaques in the brain. It shifts the focus towards systemic inflammation as a primary driver of neurodegeneration. For patients, this could mean that a simple blood test during an annual physical provides a window into their future brain health, giving them and their doctors a head start in managing risks and potentially slowing the onset of Alzheimer's through targeted lifestyle or medical changes.
Next, we look at
researchers at RMIT University have developed a revolutionary plastic film that can destroy viruses on contact. Unlike traditional antiviral surfaces that rely on chemical coatings, this material uses a mechanical approach. The film is covered in microscopic structures called nanopillars. When a virus lands on the surface, these tiny pillars grip and stretch the virus's outer layer until it literally bursts. In laboratory tests against the human parainfluenza virus 3, which causes serious respiratory issues like pneumonia, the film destroyed or disabled 94% of virus particles within just 1 hour. This physical destruction method is more effective than previous designs that tried to puncture the viruses. Because it doesn't use chemicals, there is no risk of the viruses developing resistance, and the material remains effective over time. This could transform how we think about hygiene in public spaces, making surfaces themselves active participants in preventing the spread of infectious diseases.
What makes this breakthrough even more promising is its practicality for mass production. The team used low-cost acrylic and designed the mold to be compatible with roll-to-roll manufacturing, the same process used to make large quantities of standard plastic wrap. This means we could soon see this antiviral film on everything from smartphone screens and keyboards to hospital bed rails and public transport handles. Lead author Samson Ma noted that as nanofabrication tools improve, they can further optimize these patterns to kill even more types of viruses. It offers a way to keep high-touch surfaces clean, without the constant need for harsh chemical disinfectants, which can be damaging to both the environment and the surfaces themselves. By turning everyday plastic into an invisible defender, this technology provides a scalable solution to reduce the transmission of seasonal flus and more serious respiratory outbreaks in crowded or high-risk environments, like clinics.
Now let's discuss
age-related vision loss is often seen as an inevitable part of growing older, but scientists at UC Irvine are challenging that notion. Their research focuses on a gene called VL2, which is a known marker of aging. This gene is responsible for producing very long-chain polyunsaturated fatty acids that are vital for retinal health. As we age, the activity of this gene declines, leading to a drop in these essential fats and a subsequent decline in vision. In a groundbreaking study, researchers found that supplementing with specific fatty acids could bypass the failing gene and restore visual function in mice. This wasn't just about taking standard DHA supplements, it required a specific blend of polyunsaturated fatty acids to truly reverse the signs of cellular aging in the eye. The study suggests that we might be able to treat the eye's aging process directly, potentially preventing or even reversing conditions like age-related macular degeneration.
Dr. Dorota Skoronska-Krauchik, the lead researcher, explained that the goal is to move beyond just managing symptoms to actually reversing the biological clock of the retina. The experiments showed that when these specific lipids were restored, the mice regained vision that had been lost to the aging process. This has huge implications for the millions of people who struggle to read menus in dim light or face more serious vision threats as they age. By targeting the lipid metabolism of the eye, this approach offers a new pathway for therapeutic intervention. It highlights the importance of very long-chain fatty acids that are often overlooked in standard nutritional advice. If these results can be replicated in humans, it could lead to specialized supplements or treatments that keep our eyes functioning at a high level well into our later years, fundamentally changing the experience of aging and maintaining independence for the elderly population worldwide.
Now to a story.
A sobering report from England highlights the dire health consequences for families living in temporary housing. There are currently about 135,000 families, including nearly 176,000 children, living in temporary accommodations, the highest number on record. Many of these homes have been described as unfit for human habitation, plagued by damp, mold, and extreme overcrowding. One father, Nestor Yadego, shared how his family of 4 is squeezed into a one-bedroom flat where his baby suffers from constant rashes and his older daughter can't sleep. Doctors have confirmed that these skin issues are directly linked to the condition of the house. Another mother, Alicia Samuels, reported that her son suffered temporary deafness and sleep apnea due to the mold and mice infestation in their flat. These stories illustrate a systemic failure where the very places meant to provide shelter are instead making children seriously ill and hindering their development.
The Cross-Party Housing, Communities, and Local Government Committee is now calling for urgent updates to overcrowding laws and mandatory inspections for all temporary properties. While local councils like Newham and Tower Hamlets argue that they are facing an unprecedented housing crisis, with demand far outstripping supply, the human cost is becoming impossible to ignore. The safety and well-being of residents are supposedly a priority, yet families are being moved far from their support networks into hazardous environments. The long-term impact on these children is a major concern, as poor sleep and chronic health issues can affect their school performance and future prospects. This crisis is forcing a difficult conversation about the quality of social housing and the legal protections for the most vulnerable. Without significant investment and stricter enforcement of living standards, thousands of children remain at risk of developing lifelong health problems simply because of the roof over their heads.
Finally,
new research published in the journal Computers and Human Behavior suggests that the age at which an individual begins regularly viewing adult content can predict their future mental health. While many adolescents encounter such material unintentionally, the study focuses on the point when it becomes a deliberate, regular habit. Researchers found that a shorter gap between first exposure and the establishment of a regular viewing schedule is often linked to higher rates of psychological distress in adulthood. This pattern mirrors what is seen in other addictive behaviors, like gambling or alcohol use, where early onset is a significant risk factor for later struggles. The study involved over 1,300 American adults and looked for signs of behavioral impairment, such as a loss of control, intense cravings, and the use of media to avoid negative emotions. These habits can eventually interfere with work and personal relationships, leading to long-term distress.
Lead researcher Bailey M. Way emphasized that understanding these developmental habits is key to identifying psychological risks early on. By distinguishing between initial exposure and regular engagement, the team was able to paint a more nuanced picture of how these behaviors evolve. The findings suggest that early regular use may be a coping mechanism for underlying issues or could itself lead to a cycle of emotional avoidance. This research is particularly relevant in an era where digital content is more accessible than ever. It highlights the need for better education and support for young people as they navigate the internet. If clinicians can identify these patterns early, they may be able to intervene before the behavior becomes a deeply ingrained habit that impacts mental health. The study provides a framework for understanding how digital consumption patterns in youth can have lasting effects on an individual's emotional and social well-being throughout their adult life.
That wraps up our briefing for today. Thank you for joining us for this daily update. Be sure to follow the show for your next briefing on the stories that matter most.